This video covers the second part of peripheral nervous system, which is spinal nerves. So peripheral nervous system consists of all the neural tissue that is not part of brain and spinal cord. So under peripheral nervous system, we have cranial nerves and spinal nerves. So there are 31 pairs of spinal nerves and they are grouped according to the region of vertebral column. So there are 8 pairs of cervical nerves from C1 to C8. There are 12 pairs of thoracic nerves which are labeled as T1 to T12. There are 5 pairs of lumbar nerves which is L1 to L5. There are 5 pairs of sacral nerves S1 to S5. And there is a single pair of coccygeal nerve which is CO1. Each spinal nerve is a combination of ventral root and dorsal root. So the ventral root gives motor fibers and dorsal root gives sensory fibers. Hence, each spinal nerve is considered as mixed nerve coming out from that segment of spinal cord. So each segment of spinal cord will give out one nerve. In this diagram, you can see cervical nerves C1 to C8, thoracic nerve T1 to T12, lumbar nerves L1 to L5, sacral nerves S1 to S5, and a single pair of coccygeal nerve. Some spinal nerves join together to form nerve plexus, and this nerve plexus innervates a specific group or a region of muscles. We have 4 nerve plexus: cervical, brachial, lumbar, and sacral. Cervical plexus innervates the muscles of the neck and diaphragm. Brachial plexus innervates pectoral girdles and upper limbs. Lumbar plexus and sacral plexus together is labeled as lumbosacral plexus, and this innervates pelvic girdle and lower limbs. Now peripheral nerves arise from the nerve plexus. The nerve plexus, for example, in the lumbosacral region will give rise to a big nerve called as sciatic nerve. Other example is brachial plexus will give rise to axillary nerve or brachial nerve. Now there is a clinical condition known as peripheral neuropathies. So what happens in this peripheral neuropathy is there is a local loss of sensory or motor function of a specific nerve. This could be because of nerve trauma or because of compression. Sometimes the peripheral neuropathies also can be present as a complication of a chronic disease such as diabetes. So if the radial nerve is affected, then the sensory and the motor loss is also related to the area that is supplied by the radial nerve. So here you can see the cervical plexus, which is formed by the spinal nerves that come out from C1 to C5. Brachial plexus, which is formed by C5 to T1. So C5 to C8 and T1. All these spinal nerves will combine to form brachial plexus. Next we have lumbar plexus, which is formed by the spinal nerves T12 to L4, and the sacral plexus is formed by L4 to S4. So together the lumbosacral plexus offers nerve supply to the pelvic girdle and lower limb. In this diagram you can see some of the major nerves that come out from the nerve plexus. So the highlighted ones are ulnar nerve and median nerve, which comes out from brachial plexus. Now we need to understand what is dermatome. Dermatome is the area of the skin that is supplied by one spinal nerve, and this is a sensory supply that we are talking about. So I will show you on a diagram. In this diagram, you can see that the thumb of the both hands is supplied by C6 sensory root. Another example is shoulder is supplied by C4. So the area of the skin over the shoulder is supplied by C4. The heel is supplied by S2. So these are called as dermatomes. How are dermatomes important? That damage to a specific spinal nerve or infection of that dorsal root ganglia will cause loss of sensation to the corresponding region. That means if there is an infection of C6 dorsal root ganglia, then the symptoms of that infection will be seen on the area supplied by C6. This is classically seen in a viral infection called as shingles. Shingles usually infect dorsal root ganglia, and that presents as a painful rash that corresponds to the affected sensory nerve. Coming to some of the spinal reflexes, what will happen if you step on a sharp needle? You will move your leg away from the needle. What will happen if you step on a broken glass? You will find the same response of moving the leg away from the painful stimuli. Now the response is the same and it is instant, and these are the spinal reflexes. So spinal reflexes are rapid, automatic motor responses to a very specific stimuli, and always the same response is produced. Now we have these spinal reflexes to preserve homeostasis through negative feedback. Let's look at the reflex arc. Reflex arc refers to the wiring of a single reflex, and it has a sensory receptor. So it begins with the sensory receptor and it ends with an effector. So we have 5 steps in the neural reflex arc. The step 1 is arrival of the stimulus, which activates the receptor. Now this will activate the sensory neuron in step 2. Step 3 is information processing in central nervous system. Step 4, activation of motor neuron, and the last step is response of the peripheral effector. Let's take a look at these 5 steps using this diagram. So you can see the step 1, arrival of stimulus and activation of receptor, where the hand is accidentally touched to a pin. This will activate a sensory neuron, which you can see in step 2. This is colored with a red. This information is sent to the spinal cord by sensory neuron. Step 3 is information processing in the CNS, in the central nervous system. Step 4 is activation of motor neuron. So that is shown using a black color. So activation of motor neuron causes a response by the peripheral effector, which is moving the hand away from the pin. That is the last step of reflex arc. So spinal reflexes are coordinated within spinal cord, and it does involve synapse. If you remember, synapse is a communication between neuron and another cell that will be effector. Now we have 2 types of spinal reflexes. Monosynaptic reflex is a simple reflex with just one synapse. That's why monosynaptic. Polysynaptic reflex, they are the complex reflexes and they have many synapses. Also, they may have interneurons. Monosynaptic reflexes are rapid, and usually the sensory neuron synapses directly with the motor neuron. Example is stretch reflex. This diagram explains us the stretch reflex. Step 1 is stretching of the muscle tendon that stimulates the muscle fibers. Now this is usually done by using a clinical hammer. So a clinical hammer is lightly tapped just below the patella bone. This is also called as patellar reflex or knee jerk reflex. So here the stretch receptors are stimulated and the sensory neuron synapses in the spinal cord with the motor neuron. So that is the reflex arc. The motor neuron sends the information to the effector, which is quadriceps muscles, and that causes reflex muscle contraction, which is extension of the knee. So this is the stretch reflex. We use the sensitivity of this stretch reflex to test the general condition of the spinal cord, peripheral nerves and the muscles. And this is a simple bedside test that we can do to check the condition of the spinal cord. Polysynaptic reflex is a little bit more complicated. There is a delay between the stimulus and the response because it has more than one synapse, and there could be at least one interneuron between the sensory and the motor neuron. Now the effector for polysynaptic reflex contains more than one muscle group. Example is withdrawal reflex. Let's take a look at the withdrawal reflex or a flexor reflex using this diagram. You can see in step 1 that the hand has touched the hot pan. Now here the pain receptors are stimulated and the sensory neurons will send the information to the spinal cord. The red line indicates the sensory signal. Now information from here distributed within the gray horn to the other segments of the spinal cord. Here in step 2, the interneurons are also activated. The response is indicated by the black line, and that is activation of motor neurons, which produces flexor muscle contraction and extensor muscle inhibition. So as I mentioned, there are more than one muscle group involved, and that causes release of the pan from the hand. So this is to protect your skin from getting burnt. So this kind of reflex is a polysynaptic reflex. Thank you for watching this video.